Leanne, thank you very much. I'd like to introduce myself, Catherine Mello. I'm the Executive Director of the Global Initiative on Health and the Economy at the Chamber. You may know me or my colleague, Valerie Sinden, who is right now standing behind us because we are going to re-cue the video and play it for you again, this time with the narrative. Apologies for the glitch this morning. And following that, we will start our panel program with Claire and Dr. Goetzel. So, if I could please cue the video for our audio folks behind us, please.
The world is changing faster than at any time in human history. Average life expectancy has doubled in the past century. At the same time, fertility rates have halved, and populations are older than they have ever been. These trends are drastically decreasing the size of the workforce and increasing the number of dependents for every employed adult, which places a significant strain on economic behavior and the potential for growth. But this is only half the story. The working-aged population is being impacted by alarming rates of incidences of non-communicable diseases, or NCDs. Once thought of as a rich country disease, these are now the world's largest killers and are contributing to significant losses in productivity and economic growth. Mostly adult occurring, NCDs contribute to absenteeism, presenteeism, and early retirement. Whether a country will be able to manage its changing demographics and preserve growth and prosperity for its citizens will depend on how prepared the health system is to respond to the needs of adult chronic disease. There is an urgent need for greater action by all stakeholders to succeed in combating the challenges of modern disease. Governments, civil society, and business must integrate their expertise and resources in support of health and wellness. The U.S. Chamber of Commerce is dedicated to doing just that through the Global Initiative on Health and the Economy, which has a mission to promote the economic value of good health. Together, we can make our world a healthier and more productive place to live and work.
Excellent. Thank you for sitting through that twice. I have the honor of moderating our first panel this morning, and following the remarks of Leanne, our chair of this initiative, who really talked about the challenge and the call to action of what is next. Before we get into a conversation about what we need to do, what the interventions around preserving health and enhancing productivity, we thought we would start again at the data, at the analysis that we had, at the study that originated this initiative here at the Chamber. And I would like to introduce, firstly, Claire Casey, Foreign Policy Magazine, is the managing director at FP Analytics, where she oversees global research and analysis. Claire's particular expertise, and why we sought her out for this work, is her counsel on emerging global trends and strategic forecast. Claire looked at the report that we did in 2016, which was a review of absenteeism, presenteeism, and early withdrawal. And in the process of wanting to update that for 2018, Claire recognized there was a missing tab on the bill of lost productivity, and that is withdrawal from the workforce for informal caregiving. And Claire has led some analysis at Foreign Policy Analytics, and we have that now available on our website for you, and a summary at your desk in front of you. Our second speaker, Dr. Ron Goetzel, Johns Hopkins University. If you read anything on productivity and health, if you see at the back in the footnote, there is a 2004 study that Dr. Goetzel wrote. He is the source author of our 2016 report. He is the source author of any reference I have seen on how we measure productivity in the workplace, and he is a leader in his field in understanding on how to use that data for the purpose of developing interventions. So I'll start by asking Claire to give a presentation on the recent work for the Chamber on informal caregiving.
Hello, thanks Catherine, and thanks everyone for being here. So I have a few slides and a few charts, and I will try to keep it brief and high level and not bore you with too many methodological details. But I will get into a few because it actually matters in terms of the implications of the work. So what we did is look at how the disease burden, which is sort of the number of years of your life you're likely to live with disease or disability, correlates to people having, in a society, correlates to people having to leave the workforce to provide informal caregiving. And what we found was that the average rate today of GDP losses of about 0.98% are likely to grow 26% by 2030. So a really dramatic growth rate to 1.23% of GDP. That may sound like a small number, but in the US context, that would be carving the state of Oregon out of the country. So it's not actually small at all in terms of the economic impact of this. When you aggregated it, as already stated today, with the other results earlier, you end up with in 2030 with 8.6% hit on GDP, which, to just do another comparison to put that into context, that's more than the entire financial sector of our economy. So it's a really huge impact of health and disease on the economy. So I'm going to get into a bit of methodology now, and the reason is I think it's important to understand what this analysis does capture and what it doesn't capture. So what we were able to do is look at countries and say, how is demographic change going to affect the disease burden? Disease burden is a data point that no one actually projects out to the future in terms of how society might change. But if you look at how demographic change happens, you can change the weight of different groups and their average disease to find a better average disease burden to reflect that time. So I'm going to show you two countries just to show what that means. This is Singapore. The gray bars are 2015. The red bars are 2030. That's the distribution of their population. So they're doing, in a 15-year period, there's going to be a dramatic shift in Singapore's population into the 65-plus sect. That's going to be 23% of their population by 2030. Here's the Philippines. Almost no change in their 65-plus population. The only significant shift is a decreased birth rate, so fewer children. The impact, that's the variance between their two growth rates in disease burden. So it's almost double for Singapore than it is for the Philippines. That's significant in terms of the overall results. You'll see, oh, this didn't come out very well on the slide, but you get the point, which is there's a really close correlation between the growth in your 65-plus population and the growth in the disease burden. You see these in the, I guess, top right corner. You see all these fast-growing economies, Mexico, Brazil, China, Colombia, Singapore. These are countries that are rapidly growing, rapidly aging, much faster than industrialized economies did. And they are experiencing major societal changes like urbanization and shifting family structures all at the same time, so huge challenges there. In the bottom left corner, we have some of our oldest, already aged countries, Japan, the United States, and some of the youngest countries, Philippines, Kenya, that aren't aging rapidly. And then there are two outliers that I wanted to just point out, which is Saudi Arabia. The reason its disease burden growth isn't sort of in line with where you think it would be in terms of its 65-plus growth is just the year we picked, because they're 2030, they're going to have a bulge just over 65, but their overall population is still going to remain quite young. And then Japan, which is the world's first super-aged society. And so they're already quite old, and their 65-plus population doesn't grow that much. What's significant there is the fastest 5-year increment of their population in terms of growth is 80-plus. So that is the fastest growing group of Japanese people today. So Japan's far along in this, and they teach us a lot about what we should be paying attention to. So between 2007 and 2012, in that 5-year period, in a country that is already experiencing a decline in their working age population, they had 500,000 Japanese workers leave the workforce to provide informal caregiving to a parent or relative. So they're already thinking a lot about policy interventions, what companies can do to facilitate that, and there's a lot that other countries can learn from that model, and I think it's going to be turned back to a few times today. What this doesn't capture is more of the problem, and it's more of why we're here today, which is the rise of NCDs. So none of the disease burden data actually captures what we would likely see if the trends were to continue as they have been for the last several years. So NCDs are up 54% since 1990 among the working age population, not 65 plus, but 15 to 64, so our future older adults. around the world, our lifespans are extending far faster than our health spans. And health spans is the years you live without disease or disability. So just in the last 15 years, the number of years you should expect to have to live with some sort of caregiving support has increased 7%. What that means is, short of a major intervention, the actual economic impact of this is going to be far greater than we're able to capture with the data today. So before we turn to the conversation, I just wanted to put out a few ideas that I think we should all be thinking about as we address this issue. The first is gender. So about 60% of informal caregiving is provided by women. And the women in the workforce is already globally declining in terms of their participation rate as compared to 15 years ago. So there's a real equity issue there, an inequality issue there. Today, women are more likely to enter retirement alone, in poor health, with less income. And so we have the potential to actually exacerbate that situation moving forward, depending on the approach to addressing this. Another big question I think that we need to be thinking about is how you deal with this in countries, these upper middle income countries that are rapidly aging, urbanizing, and shifting family structures without the infrastructure in place that industrialized economies have, that age at a much slower pace and urbanized at a different rate. Where are there models that are emerging? There are some interesting models that are emerging in like countries that could potentially be scaled up. And finally, how can businesses and governments both prepare for the certain increase in the need for caregiving, but also invest in interventions today to reduce the scale of that need going forward, particularly targeting the current working age population and the underlying causes of this growth in CDs. And I think technology, which was brought up before, is one of the big questions in terms of how we address this, and also a market opportunity. So that's all I've got.
And that's a lot. Thank you, Claire. So we've invited Dr. Gotzel here to have a conversation with Claire about the results of this study. And Dr. Gotzel, you've heard a little bit about how the Chamber has used this kind of analysis to put before governments to encourage a dialogue around ways in which there can be greater partnership with the private sector. I'd like to turn it to you and to you both to discuss the results of this work and maybe start our conversation on what is next.
All right, well, thank you for inviting me here. You know, what's interesting and ironic about this work, my institute at Johns Hopkins is called the Institute for Health and Productivity, but most of the attention in the United States is not on productivity, it's on healthcare and the cost of healthcare. So if you look at the latest data, we're spending close to 18% of GDP on healthcare. Now, added to that, we have productivity, which is absenteeism, presenteeism, leaving the workforce, taking care of other people in your family and elsewhere. So we're essentially adding to that GDP burden on things that are manageable in many, many, many different ways. They're in many ways avoidable and manageable. A lot of the problem has to do with the lifestyle that we lead. And right now in the United States, we're going in the wrong direction, especially in terms of obesity, which is driven by poor food choices and lack of physical activity by and large, and that is causing rise in diabetes and heart disease and all kinds of other conditions, including arthritis and so forth, and psychosocial factors like depression and detachment and aloneness. So these things are hurting the economy, and we're not paying a lot of attention to it. You cited the 2004 study that we published where we looked at 10 different conditions, things that are obvious like depression, but also things that are not that obvious like hypertension, which is uncontrolled. And it turns out when you look at these 10 conditions, productivity and presenteeism outweighs direct medical costs by a ratio of 2 to 1. They're twice as expensive as direct medical costs. And the reason for that is people are going to work, they have these health problems, they're not being managed, and a portion of their day is being chipped away by reduction in productivity. Now, why does this matter to business? Well, it ought to matter a lot to business. We published a study last year that showed that winners of the C. Everett Koop Award, which is an award we give each year to large corporations and small companies that can document that they've improved the health and well-being of their workers, if you track their stock price from 2001 to 2014. Had you put your money in the S&P 500, you would have doubled your money. That's pretty good, 105% return on your investment. Had you invested in 26 companies that have won the Coop Award over that time horizon, you would have tripled your money. So essentially a 3-to-1 return on investment from those companies that really, really do care about the health, well-being, and safety of the workers. And this is an economic issue. It's not a healthcare issue, it's an economic issue. We in the United States should be very cognizant of that, certainly internationally. And I know we're going to get into this, but the so what question is what I raised when we talked about this earlier. Now that you know this, what do you do about it? I'll slow down at that point and we'll open it up for more of a dialogue.
Excellent. Well, when we were talking earlier, Dr. Goetzel, you were talking about the importance of accuracy and measurement and how that informs policymakers and certainly our ability to advocate for greater intention and investment or use of investment in health. Can you speak a little bit to the work that we've just done with Claire and Foreign Policy Analytics about drawing attention to this issue of informal care and the emerging impact it's going to have on economics as well?
Yeah, I mean, I was interested in your slides where you've got three major stakeholders. There's government, there's the public policy world, and then there's a business world. And how do they intersect and how do they measure progress in achieving productivity improvements in society? And the solution is not throwing more money at the problem, but throwing more money at areas that are actually proven, that are evidence-based. So there's a lot of research out there. In fact, we've been working with the CDC, and there's something called the CDC Worksite Health Scorecard, which touches 18 different categories of health and well-being, many in the non-communicable disease area, but actually gives interventions, policies, programs, and activities, environmental supports that companies can adopt to improve the health and well-being and increase productivity and longevity of their workers in the workforce. So there is good evidence out there, good data, and good practices that are actually quite simple to adopt.
And I think that when you take it to the global context, I think it does get a little bit more complicated because there aren't always proven solutions, and what we need is a tremendous amount of innovation and then tracking what's working, what's not, and what could potentially be replicated elsewhere. Things I'm thinking about is the expanding of access to healthcare, which in some countries is very limited today. I look around the world and I see Turkey has made major progress on that front in the last several years. Mexico is trying to make major progress and is moving forward. China has made major progress but has a long way to go. So just expanding access to care, primary care, such that you're not just going in for once you have a problem, but are actually maintaining your health throughout your life. Brazil's been working on a really interesting program, trying to encourage people to actually go and receive primary care from physicians and health centers rather than using the emergency room as their primary form of health care or going directly to specialists. And so that's also they've been tracking it. It's reducing costs actually for the overall health system, trying to make a cultural shift in how people think about their health care, which is a challenge. When I think about the issue that we were specifically focused on, which was informal care, I think I'm going to turn back to Turkey because it's just done some innovative stuff in this area. And to me, the reason it's most interesting is that it's relevant to other like economies, whereas most of our aged economies are not as easy to apply to a developing or emerging market context. So in Turkey, what they've done is they're subsidizing the provision of a caregiver into a household of lower income people. And they're paying this person less than the minimum wage to provide care. To be said, almost everyone in Turkey makes less than the minimum wage. So that's not actually as terrible as it sounds. So they're actually drawing women out of the house and into the workforce to provide what we wouldn't necessarily consider formal caregiving, but is paid caregiving, and allowing a lower income family to have two people still working. So they're actually increasing workforce participation and addressing long-term care in the context of that is appropriate to their economy. And so there are some interesting novel ideas out there today. I think the key is, and connecting what you're saying, is tracking it figuring out what's working and what's not, and then seeing how to, one of the things I was heartened to see up there was sharing best practices, but sharing best practices among countries that have sort of like systems and are addressing common issues is really important today. Because again, the pace at which this is going to hit many of these middle-income countries is just astounding, and it will be totally out of the realm of anything we experienced in the US or Europe or Japan even.
Yeah, just one comment, and a lot of the focus, the healthcare delivery system is people who are already sick and disabled, unfortunately, and that's getting worse because of non-communicable diseases. I think we need to think about prevention in 4 phases. Now, we're used to primary prevention. Primary prevention is vaccinations and getting kids not to smoke and exercising and eating healthy, yes. Secondary prevention is identifying problems before they get worse. So high blood pressure screening, cholesterol screening, glucose, and so forth. Tertiary is you've got the disease, you've got diabetes, you've got heart disease. How can we best manage that and provide resources? One thing that we really don't pay a lot of attention to is called primordial prevention. That is the context in which we find ourselves. Housing, crime, education, intact families, those things that are societal issues, but we really don't often think about them as healthcare and prevention issues. So when government looks at these things, they need to go beyond how am I going to get you the best treatment and what about upstream, way upstream, in terms of the environment in which you find yourself, and how can we alter that to make you healthier?
And just to build off of that, because I think that fits very nicely with the movement globally, I think in terms of our view of how we need to evolve on these issues, and it's the embrace of aging in place, and actually building our communities such that they support aging in place, whether it's human connection through community centers, visits. These can be much lower cost interventions than someone ending up in a formal long-term care facility because they have a chronic condition and can no longer maintain their life independently in their house without support. But it really requires a conscious strategy and a society taking a step and saying, what do we need to build today? And to me, if this data should be anything, it should be a call to action for governments, companies, the NGO community to be getting together and thinking today about how to build that infrastructure. We do a lot of work on aging at FP Analytics, and we in fact, in coordination with AARP, and we call it community social infrastructure. So how do you create the environment such that you can access facilities, you can get to the doctor, and you have a relationship with your community and that human interaction that's so important for health outcomes?
Yeah, I mean, my focus has been on the business community and how it can influence the health and well-being of its workers. Now, in the United States, 150 million people go to work every day, and a certain portion of them are going there quite ill. So that affects absenteeism, that affects presenteeism. They may be caring for their elder parent or a child who may be sick. They may be leaving the workforce early because of these issues. So what can you do to improve the health and well-being of your workers? And there are actually, as I noted earlier, there are a lot of best practices. The problem is that most businesses don't adopt and apply those best practices. So if you survey businesses in America, as we've done, and you ask, well, do you have a wellness program? Over 80% of employers in this country will say, yes, we have a wellness program. And that may be flu vaccines. We give those away. When you ask workers, does your company have a wellness program? Only half of them say, yes, we have a wellness program. So there's a communication gap here between what companies are saying and what employees are experiencing. But employees are saying, if you gave us one, we would participate. So there's a need, an intense need to provide the information to the business community. What are best practices? How do they adopt them? How do they put them in place? And many of them are actually quite inexpensive. Or there are things like policies about smoking or eating in cafeteria, things that actually is quite easy to adopt. And we have worked again with the CDC. There's something called the Workplace Health Resource Center at the CDC, where all businesses, large and small, can go there and get all kinds of resources, easy to use, layperson written resources and videos and best practices and case studies that they can then adopt and apply in their own businesses and get to better health outcomes.
And just one of the things, in terms of NCDs, I think one of the things, in terms of interventions, again, it gets more complicated in the emerging market context. So I think diabetes rates are highest in 3 countries that stick out: Mexico, India, Saudi Arabia, and there isn't as clear a private sector to employee relationship. But that doesn't mean there shouldn't be one. It's just not something that has been instituted, I think, to date. And so again, I think in those contexts, there are countries that still think of themselves as young and think of themselves as having development priorities that come first above these broader social issues. I think the message that this is actually something that will slow your development, slow your economic growth, and slow the sort of the broader societal outcomes that you're seeking is really a critical message.
I would reflect on what we've been doing here a little bit in this context, that we have seen some governments change their response to an offer of the private sector to be more closely engaged in supporting workforce health just in the last 3 and 4 years. And you mentioned Turkey. This was a government where we presented the data, the absenteeism, presenteeism, early withdrawal data, and their response to that was to request a public-private dialogue, multi-ministry, to look at targets and an action plan for intervention. So, Claire, as you mentioned, there are some that see the urgency and are responding, and then there are some where our efforts have been less prioritized. I would like to, before we get to more questions, just ask the audience if there are any observations or questions for Claire or Dr. Goetzel, and we will pass a mic to you, please.
Hi, thank you for this informative event. My name is Contessa Bourbon. I write for the Wall Street Journal and London Times. I'd like to ask, for Claire, do you have a data on how much GDP is impacted by workers who are forced to leave their work because of illnesses, specifically for France and Spain? And how is the aging population there?
So I'm going to turn that over to Catherine, because that's not the data that we worked with.
We did not profile France or Spain in our study, but Dr. Goetzel, if I could turn to you, I know that, I mean, you were asking for an absenteeism fig. Yeah.
Yeah, no, I don't have any specific data on that. I think certainly when you talk to foreign governments, productivity is a much bigger driver for them to do something than healthcare, because most systems out there are national healthcare systems. Just came back from Brazil, and most employers, well, the government is paying for health insurance, so it's not my problem. My problem is absenteeism and presenteeism, and safety issues. Those kinds of things are critically important outside the United States. So is there any evidence that if you intervene, if you provide their workers with programs that are evidence-based, then you can actually move the needle on these things that matter to them. People coming to work every day and being mentally present there, which is what presenteeism is about. I don't have any specific data on France or Spain.
Thank you. Good morning, Christina Morosi. Speaking from the clinical perspective, just to clarify, were you speaking earlier about living with chronic disease when you're talking about being present, living with productivity, and your reference to such issues as diabetes? If you could clarify from the non-U.S. perspective what you're seeing, because obviously on the U.S. side it's a huge epidemic.
Yeah, the fastest growing rates of diabetes around the world are actually in emerging market economies. So again, we're seeing these massive societal transformations that just happen a lot faster than they happened here, and without the health infrastructure to actually address it. And when I said that the role of the private sector might be more limited in these markets, the only point there is so much of those economies are informal that it does require more of a public sector focus if you're going to address really the scale of the challenge. Not that the private sector doesn't have a role. In fact, I think in some ways it should be viewed by the private sector as a market opportunity to increase access to healthcare services, insurance, what have you.
Yeah, in the United States, close to 100 million Americans suffer from diabetes or have prediabetes. And that's, think about it. It's about a third of the population has this problem. And if you go to the CDC website and they've got these wonderful maps of the United States. On the left side, you've got obesity prevalence. On the right side, you have diabetes prevalence. And you go back about 20 years, and you see the two maps growing in size, in color, and shading for the states that have high obesity rates and high diabetes rates. And it's an unmistakable correlation between those things. So diabetes is a preventable condition. Type 2 diabetes is preventable. And we just are not doing enough from a private sector and a public sector to try to address that. Yeah, tobacco is actually, that's one of the public health accomplishments in this country. Our rate of tobacco use has dropped precipitously going back to the 1960s when the Surgeon General's report was issued. It used to be, 40, 50% of the population was smoking. I know internationally it is still very, very high, certainly among men. Today in the United States it's about 15%, thereabouts. And it's a combination of education and public policy. One of the most effective strategies is taxation. I hate to say this in the business community, but increasing the cost of cigarette packs through taxation has been one of the greatest interventions out there to get people to quit smoking, especially poor people.
Thank you all. I'm Rachel Carrillo. I'm a writer. I'm also from the NGO sector. And my question's for, I guess for both of you, but Claire specifically. One of the NGO hats I wear is with the United Nations Association, and they're focused on the Sustainable Development Goals, 17 different goals by 2030 to help eradicate poverty, and Goal 4 is health and well-being, and then the last goal is Goal 17 is partnerships and collaboration. And I'm wondering how any of the Sustainable Development Goals help inform your research, if at all, or any collaborations therein. And then more specific to your comment about the community access infrastructure, I believe you called it. Here in the States, are you finding any trends with some of the new rideshare programs helping get folks that don't traditionally have access to healthcare, like immigrant and refugee communities, or even low-income workers and homeless communities, to health appointments?
So I'll take your second question first. I actually don't really look at the U.S., so I can't speak to the United States. But the potential for technology to close the gap in terms of access to healthcare is huge. So ride sharing, but also Korea is trying to address the healthcare needs of the country and efficiencies around that, particularly with the rural population, by something they call the U-Health Initiative, Universal Healthcare, and it has an e-health element to it, so where you can send a picture to a doctor of something growing on you and get a response and know if you need to try to make the journey in. And I think ride sharing, there's really no limit, I think, to what technology can do if thoughtfully applied in terms of increasing people's access to healthcare resources. So that's a huge part of it. Remind me what the first part was. Oh, the sustainable. Oh, absolutely. So, I mean, I think the question is, where are countries? So a lot of countries are working to expand. I think the goal is universal health care officially in the SDG. And so I think that's the first step. And then the next step is, how do we define health care? And so then it becomes a question of quality. And that'll be the next step for countries. But yeah, I mean, there is a lot of progress around the world in certain markets, and not everywhere. And then expanding access moves to then improving the quality of the healthcare you're receiving. I was just having lunch with a colleague who's just recently moved back to China, and he was explaining what, China has said they're moving towards universal access to healthcare, but the quality of the care for an average Chinese person is extremely low, and they have to pay for everything. And so you may be able to go, but you may not be able to afford it.
on the topic of global sustainability goals, one of the areas that we've been studying is corporate social responsibility writ large. Kind of what is their responsibility to the community as well as their workers. So you find that a lot of large companies are very focused on their workforce. They want to keep people healthy and productive for all the reasons we talked about. But in terms of improving the health of communities, that's actually a very different challenge that they have. You know, what can they do to improve the health of communities in which they are based, in which the company is built? So there's a lot of research out there looking at companies that focus on their workers, are usually listed on the Fortune 500 list of companies that you want to work for, that are best for women, best for ethnic and racial minorities, and so forth. Very little research out there on what companies are doing to improve the health of communities. We're actually in the middle of one of those studies right now, but defining it is difficult. You know, kind of how do you prove that your actions are actually improving the health of communities? I think that's a challenge for the corporate community to go beyond their own walls, not only improve their workers' health, but also community health, because that's the source, that's where they get future employees to come work for them.
And I'll just comment on that point from the perspective of the Chamber. One of the priority programs that we have at the Global Initiative on Health and Economy is profiling successful examples of employee and employee family health programs. And what is important in the work that we do internationally in our emerging markets is making sure that those models are scalable and adaptable to the market community around us. We have national partnerships. U.S. Chamber would partner with the Saudi National Chambers of Commerce, and we have profiled examples of Saudi companies doing healthcare programs for workers and their families. We've profiled U.S. companies, and it is an exercise in awareness, and it's an exercise in showing value and presenting some of that return on investment data that you mentioned. And then there is the task of compliance and performance by employees. But I feel proudly that it's a very positive contribution that an organization like the Chamber can provide in the communities in which we're invested. We have excellent best practices over 10, 20, 30 years plus for some of our companies. Not all of the companies have worked on it, but we certainly have enough data there to share that is compelling for other smaller companies in these local markets to look at the benefit of doing it for the sake of productivity. Any other questions? We'll take these two.
Yes, my name's Joe Hurd. I'm from a Chamber of Commerce in Western Pennsylvania, and we have a very active workplace wellness program, a committee that helps get some information on a regular basis to employers. I'm wondering whether it's a degree of urgency that needs to be out there, and certainly these statistics reflect that the situation is very serious. But I would imagine I'm one of the, from looking at the makeup of this program today, I'm probably one of the only chambers of commerce that are here. I don't know how to get other chambers to see the importance of engaging businesses to, not only put wellness programs together, but to take this this issue and give it the attention that it so rightfully deserves.
Yeah, I'll direct you actually to one best practice chamber that I've been involved in the last couple of years, Nashville, Tennessee, and their Chamber of Commerce. They have put health and productivity as the #1 priority for that Chamber of Commerce. They have 2,000 businesses that are members, and that is their focus. And the reason for that is that, of course, because of aging, people are leaving the workforce, and they need to replenish that workforce with new people coming in. And the way to do that is to, of course, make Nashville an attractive community, but secondly, make sure that it's the healthy people who come there and the healthy people who are sustained there. So they have they've gone all in making that a priority for them. And I encourage Western Pennsylvania, and you've got some wonderful businesses out there, including some excellent health plans and University of Pittsburgh and Highmark and others that have exemplary programs, but have them focused not just on the treatment side, if you get sick, you can come here, but on the prevention side, on wellness and health promotion and productivity management, and bring that to their attention, especially these statistics about productivity losses.
So the business community's attitude seems to be more, we'll get to that.
Well, they will. Eventually, it may hurt when they get there.
And we can certainly reach out and help encourage you with your members to have them get to that sooner with the data that we have. 2 last questions, if we could take them together, and then we'll close the panel. One here. Katie, one here. Please.
All right. Hello, my name is Sheena Foster, and my question is, so I see you all have like a lot of research on like productivity. So are there any studies being conducted, for example, if the employer is the impetus for someone's health conditions, if they're working at a factory in China, or if they're working someplace where it's even longer hours and the environment is causing their health conditions, are there any studies to be done? Because if they have some sort of program and they're providing health care, but they are the one that's causing the conditions, what are we doing about that, and who's researching it?
Yeah, actually, there's a lot of work done in this country with NIOSH, which is the National Institute of Occupational Safety and Health, something called Total Worker Health. And the idea there is to connect worker safety to health and health promotion. They've been doing it for over 10 years now. John Howard is a director of NIOSH. It's his passion to connect those dots of making the workplace a healthy environment. And there's actually a lot of research showing that if you take those 2 ideas, put them together, you're going to achieve better safety and better health outcomes. But the other thing, and we're doing research in this area, is not just focusing on individual health, but organizational health. So, you may want to be healthy, but if you're working in a toxic environment, whether it's chemical toxins or your boss is toxic, that's going to affect your health and well-being. So we developed a lot of cultural assessment tools. The one that I mentioned earlier is one that's widely used, the CDC Worksite Health Scorecard, that looks at organizational support and whether you work in a positive environment that supports the health and well-being. And one of the best ways to gauge that is to actually ask the workers, is this a good place to work in terms of my health and my health improvement? And that ought to be another important metric, not just the workers' health, but the organization's health.
And this study doesn't break it down to that level of detail for a company, but we have done, a partner of ours in Mexico did do a study on 3 manufacturers in Mexico and broke it down by disease, and were surprised to find that there was a high degree of impact on productivity related to migraines and headaches. And if this study does anything, it motivates an employer to want to change those conditions to improve productivity, and that was certainly the response that these studies provided.
Eagles Milbergs. I'm a co-founder of a nonprofit in Seattle that helps companies start up, help entrepreneurs. A question on solutions here, not the problem definition, but out in Seattle, there's a suite of technologies developing that I would characterize. Leroy Hood calls it the 4 Ps. Preventive technologies, personalized technologies, predictive technologies, participatory technologies when it comes to healthcare, all aimed at trying to deal with these kind of diseases that you're talking about. I wonder what your opinion is on how to accelerate the deployment of this kind of technology and where that leadership is going to come from. Being more specific than private sector or government. Which industry sectors are likely to adopt these kinds of practices? Which countries seem to be leading the way when it comes to preventive approaches and wellness approaches?
Yeah, I think it's the name of the game right now in terms of technology and artificial intelligence and all the apps that we rely upon, and some are must-have like Google Maps and others are fun to have. I think those are going to be major movers and shakers of people. However, I'm a strong believer in human contact, getting away from your iPhone and getting away from your computer and actually having human interactions. Turns out, and these are studies that have gone out some as began in the 1930s, the Harvard Men's Study. And they looked at longevity of these Harvard-trained students into their 90s and beyond, and they found that human connection actually was one of the strongest predictor of longevity and healthy lifestyle and lowering disability-adjusted life years. And I think we're unfortunately moving away from that through all this technology, that we're relying upon friends that are not really friends on our iPhones and Facebook, instead of having one-to-one human interactions with our friends and family. So I worry a little bit about the technology world kind of taking the humanity, sucking humanity out of us. I think it's certainly absolutely essential in terms of medical care and medical treatment, but I think there needs to be a balance.
I'm going to go a slightly different direction, although I couldn't agree more on the importance of human connection. I think of technology as a force multiplier. So it's something that enables the components of life that we need, and human interaction is one of them. What's interesting is if you look at older adults, the primary sort of gateway drug for smartphones is getting on social media, being able to be on FaceTime with their grandchildren. So actually enabling human interaction is how you're more likely, if you're 65 plus, to pick up a smartphone and get engaged technologically. And then it can be used to access healthcare, order online, and do all sorts of things that enable your life. In terms of markets, I would again point to Korea. And it's an interesting phenomenon in Korea. Demographically, they're about to have their baby boom go 65 plus. So they're about to have a dramatically different older adult population. So today, their older adults are relatively poor, have poor health outcomes. The new generation, this bulge, is going to come in with a lot more money and a lot better sort of health status going into 65 plus period of their lives. And the government is recognizing that there's a tremendous market opportunity and a tremendous opportunity for technology to play a role in meeting that. And they're right now, because the private sector is, I think, a little bit wary still, because it's a 5 years away market, not a tomorrow market, that the government's really trying to provide the pull and create demand in the market for these technologies, encourage companies to innovate and be thinking about that stuff. So in terms of places where exciting things are happening with technologies geared towards health and the older adult population, Korea is an exciting place to be following today and for the next few years, I think.
Excellent. Well, that concludes the time we have for this panel, and I want to thank you both for setting the stage for our discussion here on the issues of productivity and health, and the importance of looking at it from the perspective of economic impact. Claire, thank you for the thought leadership you've provided us at the Chamber with our study, and Dr. Goetzel, thank you for your academic work in this area, and for, of course, all your source material that we use so regularly in our analysis. Both are staying with us for commentary on the next panel, so I invite you to take your seats.